I'm Dr. Desiga Moodley, the head of scientific and educational studies here at Edelweiss Dentistry in Austria. All comes down to this laser sintering and vitrification process that is unique to Edelweiss Dentistry, whereby we subject the material in the laboratory through extensive laser sintering, and this improves the physical and optical properties of the material. So for the first time now, we see that the material has improved in terms of compressive strength to that of lithium disilicate or particle-filled ceramics, and the optical properties now mimic the natural enamel. And that is what we wanted. We wanted the restoration to be as close as possible to the natural tooth.
I have a very strong abrasion of my teeth because of the Proximus. About 20-30 years I cut them down, and they are very small at the end, and my father has the same problem and he needs all the teeth new.
So following extensive laboratory testing, where we pulled and pushed and tested these materials, we then were ready and confident to now take it to the clinical situation. And Thomas was one of our first patients. He was a bruxer, and we thought this would be an ideal situation to test our CAD/CAM blocks.
So patients like Thomas Thornhair, which we have in our presentation or which we shown in this situation, we have many of these patients. So there are a lot of symptoms patients are having and they have no help nowhere. So they go to the orthoped, they go to the physical therapists, and they do MRT and MRI and a lot of things. They have symptoms. We just solve these problems by changing the bite position.
My doctor tell me I have to do it now because the rest of my teeth is still okay, but this is the last chance. If I don't repair it now, my teeth will go to the nerve and I will become bigger problems.
What does that mean? What we do is we bring the mandible in a symmetric position to the cranium, to the head. That means our muscles, right and left side, they have the same length. They are guided by frontal and canine guidance. And so we are the last one who comes together with these patients, but we can help most of them.
I heard from a friend that he knows Edelweiss, and they have also done some repairs on his teeth, and he was really happy with it, and so he told me I should come here and ask what they can do for me.
And I'm proud to say, following 2 years of clinical use in Thomas's mouth, I found no change in the optical properties. There was no staining of the material. There was no chipping of the material, of the restoration itself. There was no fractures or cracks. And this functioned well in his mouth.
I have heard the first time that they can repair the teeth. They don't have to use ceramic and other things, which is too hard. And ceramic on both teeth is much harder, and it will destroy all what is left of my teeth. And with the Edelweiss possibility, the new teeth will be about the same hard as the old one, as the normal teeth. And there is no problem if something breaks, they can repair it. And with ceramic, there is no possibility of this.
And for me, this is the most important thing. Developing a material in the laboratory is one thing, but having clinical success and patient satisfaction is the most important thing. And I can proudly say today that Thomas is very happy with those restorations, and they have stood the test of time.
Not everything is because of the bite, of course, but when we change this bite in a symmetric position and we're going in a relaxed position, in a free position of the condyles, let's say, muscle can relax, and they are influencing all the rest of our body. So we have one chain of muscles, and what we do is finally we treat the teeth, but we solve the problems caused by the muscles. So what we can say, we have our special technique where we can find out 100% the correct bite position of the lower to the upper arch. The position of our mandible is depending by our maximal intercuspitation. So Our habitual bite is our habitual maximal intercuspitation, and that does not mean that this is good for our TMG or that it's a fine position for our muscles. Muscles are changed, they get relaxed by the splint already, and then we have to fix it in a permanent situation. So that's why we have to add occlusions, and it's just additive, so it's minimal invasive, as you saw already, and that's the whole magic thing. And it's so logical when you just think about to bring the mandible in a symmetric position to the maxilla, to the head. That's all.
It was very fast. They can repair my whole teeth. I think they repaired 24 teeth in one day. And in the evening I can leave. It was the birthday of my girlfriend, and I can show her my new teeth, and it was a wonderful day. And in the evening I can normally eat and everything, and it was like always, like with my old teeth, and it was really nice.
Another unique feature of the Edelweiss CAD/CAM blocks is the cementation process. So for the first time in history now, we have a block and the cement that has the same composition. So what does this mean? This has two advantages. The first advantage is that because we have the same composition, they act as a monoblock. The cement and the restoration acts as a monoblock. Then it does not have any issue, you would not have any submargination or ditching at the margins. The other important advantage of this monoblock system is you would not see any discoloration or color difference between the cement and the restoration.
They are white and nice, and after 3 years they are still quite okay. And each day I think if I have not done this, I have to do it because it was one of the best ideas in my life.